In the world of EMS, we like to keep things as easy as possible and easy to remember. For that reason, we utilize many different acronyms and mnemonics. Here at EasyEMSCU.com, we like to call this our EMS alphabet soup. SAMPLE is an EMS assessment tool mnemonic to assist EMT providers in obtaining a complete and comprehensive as possible patient history. SAMPLE in its very basic form stands for signs and symptoms, allergies, medications, past medical history, last oral intake, and events. Using this very basic mnemonic, an EMS provider would get only the very basic patient history. In order to use SAMPLE to its fullest potential, we have to dig deep and really examine what each letter means, and how we can use this assessment tool to garner the best history, most efficiently, to gain the most useful information. The S in SAMPLE stands for signs and symptoms. Signs are objective findings, meaning something that the EMS provider can see, hear, feel, unfortunately, sometimes smell, and measure in some way. Examples of signs would include lacerations with bleeding, which of course, is something the EMT provider could see and possibly feel, through gloves of course. Facial droop from a suspected stroke, again something they could see. Abnormal breath or lung sounds, something they could hear. Crepitus from fractured bones, something they can also feel. Acetone or fruity breath in a suspected patient with a diabetic emergency, something they can smell. And blood pressure or a temperature, both of which an EMT provider could measure. Symptoms are subjective findings, meaning sensations or experiences that are reported by the patient, or through someone else on behalf of the patient, to the EMS provider. When asking about a patient's symptoms, remember, who are we as EMS providers to say what our patient feels or does not feel? We can only base symptoms' subjective findings based on the information provided to us by our patients. Examples of symptoms would include chills, pain, or nausea, to name just a few. When asking patients about their symptoms, it's also a good idea to go ahead and ask them about the current state of their symptoms. Have they resolved, or are all or any of them still present? Often, signs and symptoms will present in pairs. Some signs and symptoms that commonly present together include nausea, a symptom, and vomiting a sign, chest pain and respiratory distress or difficulty breathing, and abdominal pain and diarrhea. Remember, when it comes to signs and symptoms, we may not be able to personally experience the symptoms that our patients report to us, but we can in some way sense or measure their signs. The A in SAMPLE stands for allergies. We should of course, be concerned with known allergens that cause severe allergic reactions, known as anaphylaxis, but we should also be concerned with a wide range of other potential allergens, which may cause less obvious SIGs on allergic reaction. Sometimes, being cognizant of the lesser-known results of a minor to moderate allergic reaction, those which may be easily missed in comparison to those associated with an anaphylactic reaction, can explain some of our other assessment findings. While we as EMS providers recognize the obvious signs of allergic reactions and anaphylaxis, including hives, itching, flushed and pale skin, hypotension, airway and or throat constriction, gastrointestinal involvement, and altered mental status, if we also understand the lesser-known signs and symptoms of allergic reactions, we can sometimes find the answer to our own question. Why is my patient presenting with this otherwise unexplained sign or symptom? Some of these lesser-known presentations can include generalized itching, nasal congestion, rashes, watery and red eyes, abdominal pain, anxiety, chest discomfort or tightness, cough, diarrhea, dizziness or lightheadedness, flushing or redness of the face, nausea with or without vomiting, heart palpitations or feelings of an abnormal heartbeat, and unconsciousness. While we as EMS providers recognize the obvious signs of allergic reactions and anaphylaxis, including hives, itching, flushed and pale skin, hypotension, airway and or throat constriction, gastrointestinal involvement, and altered mental status. If we also understand the lesser-known signs and symptoms of allergic reactions, we can sometimes find the answer to our own question. Why is my patient presenting with this otherwise unexplained sign or symptom? Some of these lesser-known presentations can include generalized itching, nasal congestion, rashes, watery and red eyes, abdominal pain, anxiety, chest discomfort or tightness, cough, diarrhea, dizziness or lightheadedness, flushing or redness of the face, nausea with or without vomiting, heart palpitations or feelings of an abnormal heartbeat, and unconsciousness. Some of the most common drug or medication allergies, as to penicillin, an antibiotic commonly used in the treatment of pneumonia and respiratory infections. This allergy can develop in childhood, but can also be outgrown. Chemotherapy drugs, nonsteroidal anti-inflammatory drugs, or NSAIDs, such as aspirin or ibuprofen. Patients with aspirin allergies are typically also allergic to other NSAIDs. NSAIDs allergies can develop slowly, over times and after repeated doses. Anticonvulsants, sulfa drugs, which are sulfonamide-containing antibiotics, medications for autoimmune disorders, and insulin, which although is naturally occurring in the human body and produced in the pancreas, is now synthetically manufactured in labs and can be recognized by the body as a dangerous foreign invader. The most common environmental allergens are pollen from trees, grasses and weeds, and mold, in the forms of microscopic fungal spores. Both pollen and mold can be easily inhaled and cause allergic reactions. Common animal allergies can be caused by furry animals, not by their actual fur or due to hair shedding, but due to pet dander, which are proteins found in tiny flecks of their skin. Dust mites, particularly allergies to their droppings and dead bodies and parts. Cockroaches, particularly their feces, saliva and body parts. Mice from their skin, saliva and urine. And insect venom, from stings, bites, also known as envenomation, or such insects as yellow jackets, hornets, wasps, bees and red ants or fire ants. Another very common allergy, and one that is particularly prevalent among healthcare workers, are latex allergies. These allergies are to the proteins which are present in the milky sap of the Hevea brasiliensis rubber tree. This is generally an allergy that develops over time and after repeated exposures, hence why it does tend to be prevalent amongst healthcare personnel. Luckily, we are seeing less and less medical equipment, including gloves and other personal protective equipment, PPE, that are latex containing. The M in sample stands for medications. We of course will be concerned with medications that have been prescribed by a physician or healthcare professional. And we must ask, is the patient taking the medications prescribed to them, or they have been told to take? If they are not, why aren't they? Perhaps they do not like the way the medication makes them feel, or perhaps they experienced a side effect. Maybe they aren't able to get their medications due to difficulty getting to a pharmacy or due to the cost. We must also ask, is the patient taking the medications as prescribed or advised? If they are not, why aren't they? Again, maybe they feel that the dose they were given was inappropriate, too much of too little. Maybe they cannot afford to take a whole dose because of the cost of the medication, So they are cutting their tablets in half with a "some is better than nothing" mentality. Perhaps, because they have to work to survive, they only take a medication that could make them drowsy at night time, so they can still drive to work or operate machinery at work, instead of taking a medication twice a day, once in the morning and once at night time. So often there are human factors that impact why a patient may be totally or partially non-compliant with a healthcare professional's orders. It is easy to look at a med list, hear the patient say they are not taking their medications, or not taking them like they are supposed to, and simply write them off and label them a non-compliant, potentially difficult patient. In order to be the best patient advocate, we need to ask those additional clarifying questions to get the full story. Common prescription medications include atorvastatin, brand Lipitor, which treats high cholesterol, levothyroxine, brand names Levithroid, Lavoxyl and Synthroid, used to treat hypothyroidism, metformin, brand names Fortamit, Glucophage, Glumetza and Riomet, used to treat diabetes, lisinopril, brand names Prinaval and Zestrol, an angiotensin-converting enzyme, or ACE inhibitor, used to treat high blood pressure, amlodipine, brand name Norvasc, a calcium channel blocker, used to treat high blood pressure, coronary artery disease and angina, metoprolol, brand names Toprol XL and Lopressor, a beta blocker, used to treat high blood pressure, angina and heart failure, albuterol, brand names Acuna, Proair, Preventil and Ventolin, treats asthma, bronchospasm and other lung problems, omeprazole, brand name Prilosec, a proton pump inhibitor, or PPI, used to treat heartburn, GERD and stomach ulcers, losartan, brand name Cozar, an angiotensin receptor blocker ARB, which is used to treat high blood pressure and kidney disease, gabapentin, brand names Horizont and Neurontin, used to treat partial seizures, nerve pain and restless leg syndrome. Although prescription medications are very important when performing our patient interview and history gathering, we should also be concerned with any over-the-counter, OTC, medications that our patients are taking or have taken. The most common over-the-counter medications include acetaminophen or Tylenol, ibuprofen, with brand names such as Advil, Midol or Motrin, fexofenadine, with brand names such as Allegra or Mucinex, loratadine, brand names Claritin or Olivert, hydrocortisone cream, dextromethorphan, which is common in many OTC cough medicine, pseudoephedrine, brand name Sudafed, a decongestant, bismuth subsalicylate, with brand names such as Kaopectate, Pepto-Bismol or Maalox, and diphenhydramine, as known as Benadryl. We should also be concerned with any vitamins or supplements our patients might be taking, such as multivitamins to ensure adequate nutrition intake, vitamin B supplements for bone health, immune function and cardiovascular health, omega-3 fatty acids for heart health, brain function, and to help with inflammation, vitamin C, an antioxidant to help with immune support, CoQ10 to help with energy production, and various other health benefits, probiotics to help with gut health and immune support, turmeric supplement, an antioxidant that helps with inflammation, vitamin B12 that helps with nerve function, red blood cell production, and energy metabolism, fish oil for heart health, brain function, and to help with inflammation, and B-complex vitamins including B1, 2, 3, 5, 6, 7, 9, and 12, to help with energy production, nerve function, and various other processes. In addition to the aforementioned medications, prescribed medications, over-the-counter medications, vitamins and supplements, There are other things that our patients may be using for medicinal purposes, or in the hopes of helping or curing what is ailing them. Some of things may include essential oils, which may be diffused, applied topically or ingested. Various home remedies, medicinal plants, which can be consumed or utilized in various carriers, tinctures, teas, salves, and by other means. And illegal or street drugs. The P in sample stands for past pertinent medical history. Often, patients want to give EMS providers their entire medical history, but in order to ensure we are using our assessment tools as efficiently as possible, we have to start by having the knowledge of what the term pertinent means in the realm of EMS. When interviewing our patients and asking about their past pertinent medical history, there are a few key items we should hone in on, like any major illnesses or injuries the patient has experienced in their lifetime, including psychiatric issues. Any chronic illness that the patient has, including those with symptoms that are currently under control with medications, therapies, or other means. Any fairly recently surgeries or procedures, generally within the last 18 to 24 months. Any previous major surgeries. Think surgeries or procedures which would be applicable to such questions, like do you have all of your original parts? Do you have any new or replacement parts? Do you have any artificial joints, valves, or implants? Any recent hospitalizations, including the reason for the hospitalization, and any treatments the patient underwent while there, or as a result of their hospitalization. Any relevant familial history, such as but certainly not limited to cardiovascular, pulmonary cancers, chronic issues. And any of the patient's social history, such as drinking alcohol, vaping, smoking, or drug use. And any applicable details, such as specific substances, how often and how long they have been using. Obtaining a detailed and relevant past medical history is not only so EMS providers can sound like we did a good job when delivering the handoff report at the hospital, or saving the charting hospital staff time with their patient interviews and documentation. It serves a vital purpose for the EMS purposes as well. Obtaining the necessary information about a patient's medical history can lead us in the right direction and help us narrow our list of differential diagnoses, which can help us determine most important treatment modalities pre-hospital, meaning it helps us determine the most appropriate treatments and interventions for our patients based on a total picture of their presentations. It can also help us avoid potential complications or interactions between our patients and a chosen treatment or intervention. For example, it is relatively contraindicated to obtain a blood pressure on the side that a patient has had a mastectomy due to the risk of lymphedema, but if we do not determine that our patient has a history of a mastectomy, how would we otherwise know to avoid a blood pressure on the affected side, and therefore avoid the potential complication? And ensuring that we obtain a detailed and relevant past medical history always aids us in our duties to be the best possible patient advocate we can be. Having this knowledge of our patients allows us to offer the best and most appropriate support for their current situation, and helps us ensure that they are always making the best and most educated decision for themselves regarding their health care. The L in sample stands for last oral intake. As easy as it would be to simply ask, what was your last oral intake? This letter and sample opens a door for the EMS provider to gather so much more potentially useful information and clues about what could be going on with our patients. It is completed appropriate at this point in our patient assessment to ask when the last they consumed anything by mouth. This can include foodstuffs, water, other beverages, medications, or anything else. For example, for patients with the eating disorder pica, They may be regularly consuming things that are not considered food. So asking these questions with only foodstuffs in mind could lead you down an inaccurate path. It is also appropriate to ask specifically what the patient has consumed and follow up with questions regarding if it is something that they regularly consume or something new they have decided to try. This would be significant to determine if the signs or symptoms are abnormal based on intakes that are routine for the patient, which could help eliminate the last oral intake as a contributor, or lead us to add the last oral intake to the list of differentials for that patient's presentation. There could also be value in knowing who made the patient's food or where, as in what restaurant or establishment it came from, especially if we think we could be dealing with a food poisoning or improperly prepared or handled food situation, which could evolve from the isolated case we are at present dealing with to something more widespread and potentially a public health risk. We can further ask our patients how they feel after eating or drinking their last oral intake. This may seem like a question we have already answered by asking about signs and symptoms. And although we may already know what signs and symptoms the patient is or has experienced, by establishing what signs and symptoms existed prior to their last oral intake and which ones presented after, can help us build an accurate timeline and potentially assist in pinpointing the causes or eliminate potential causes of each sign and symptom reported. Asking has the patient felt like this after consuming this or anything else before, again can lead us to determining causation or potential elimination for our list of causes. And again, we can try to garner additional information about the timeline and how signs and symptoms presented by asking what specifically presented after the patient ate. This is a good time to ask if the patient is still experiencing any or all of the reported signs and symptoms, or if they have resolved. The E in sample stands for events, specifically the events leading up to the injury or illness. Along with the simple question, what happened? We also should ask some additional clarifying questions, such as when did the event occur? As in how long ago did it happen? Where did the event happen? How did the event happen? How did the timeline of events happen? If the event is a little more complicated than the patient fell, what lead up to that? Did the patient trip over their dog, slip on a rug, fall and strike their head on a side table, for instance? Can you think of a reason, or do you know why the event happened? It may be appropriate to ask the patient this question if they are oriented enough and capable of being an accurate and trusted historian. It may be more appropriate to ask a family member, caregiver, or bystander this question instead, who witnessed the event. In a similar way that we are concerned with getting the name and contact information for those who provided last known well information for stroke patients, it may be relevant to gather that information for other patients as well. If we feel our patient is fragile and may lose the ability to answer questions themselves, should the need for additional information arise, or once they arrive at the hospital, it could be necessary to have the person's name and contact information for any needed follow-up. Sample in its very basic form stands for signs and symptoms, allergies, medications, past medical history, last oral intake, and events. But as you can see, when used as an assessment and interview reminder tool, and when think about what these questions mean on a deeper level, the amount of useful information we can garner from utilizing it efficiently is vitally important. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And that you for visiting easyems.com.